Right, so we'll assume that in this demonstration of staple and suture removal, we'll assume that we have already cleansed the wound. It's a well-approximated surgical wound, and it's being cleansed. So now it's just removing. So for the sutures, you're going to lift up the best you can. You're going to take your suture blade or suture scissors and cut as close to the skin as possible without cutting through a knot. And then you're just going to pull only the sterile material through the wound. There's one out. I recommend that you get rid of alternate sutures first. So lift up as close to the skin as possible and remove without cutting through a knot. Keep going with the alternates. And then once all those alternates have been removed, you look at the wound and say, does it still look well approximated? Does it look like I'm good to remove the rest? And I am, so I will remove the rest of them. And of course, the whole thing is initiated following a physician's order or a nurse practitioner order to remove the sutures. So now all the sutures are out, and we would apply steri strips at this point, which you don't need a doctor's order for. And that just helps keep the wound well approximated and gives it a bit of tensile strength. But I'll show you that steri strip application after we remove staples. So now we'll say we've got a wound that needs staple removal. Again, we've cleansed it already, and now we're going to start removing the staples. We have an order to remove staples, and we'll remove alternate staples first. I like to take at least what begins as a sterile piece of gauze, and I like to put it down over top of the wound so that as I'm removing each staple, my hand can rest on it and I'm not right on top of the wound. So putting the correct edge of the stapler underneath the staple and making sure that you depress the top all the way down so as to bend the staple. And then gently rock it from side to side because sometimes it sticks onto the skin and can cause irritation. So don't pull straight up. So doing alternate staples again, just like we did with the sutures. Move to the next one, so you can move your gauze down to the next one, alternating fashion. Get your edge right underneath the staple. And again, the two things to remember at this point, number one, push all the way down to bend the staple, and then rock from side to side gently to lift it out. So we'd finish up removing all of our alternate staples. And if we liked how it looked, then we'd remove the remaining staples as well. Now let's just go to application of the steri strips. So we'll use this one where we took the suture wound, where we took all the sutures out and they're all gone. The first thing I want to do is apply some skin prep because it helps the steri strips to stay on a lot longer. So just applying that skin prep on the outer edges where the steri strips would stick. A lot of the steri strip packs come in these really long forms, which could be useful in some situations, but I find often I'll just cut them in half because it's long enough, but you'll have to decide. I've decided that I'm not at risk for exposure to blood and bodily fluids, so I find it easier to apply these with my bare hands. You're okay to touch them, just don't touch the edge or the middle part that's going to be on top of the wound. And so the principle with application of steri strips is, my skin prep's not quite dry, we'll just have to speed up the process here. But we'll say that dried on its own. What you do is you put this down on one end and pull with a little bit of, give it a little bit of tensile strength without bending the wound. And then therefore the next one you would start on the opposite side so as to not have it going in one direction, all the pressure. Start on the opposite side, pull and apply. And you want a nice little space, approximately about the same space as was there when the sutures were in. 4 staples, and then again from the side. So again, to repeat, and you just keep doing that the whole way down the wound. You're not trying to cover the whole wound. You want air to get to it to heal, but you can see I've spaced them out. And again, the principle being that once the skin prep or the Cavalon has dried on its own, you'll start on one end and pull, then the second one will be on the other end and pull, and the third one will be on this end and pull. Not too tight, not too loose. It's just enough to give a bit of tensile strength without causing the wound to bend.